Hey everyone, and welcome back to the channel. Today we're diving into a very popular and often misunderstood procedure, the tummy tuck, also known as the abdominoplasty. If you're thinking about getting one or just curious about what it involves, we're going to cover exactly what it is, what it's not, and the trade-offs and the real risks, so you can make a fully informed decision. A tummy tuck is a body contouring surgery. It's not a weight loss procedure. We remove excess skin, sometimes tighten the separated abdominal muscles known as diastasis recti and redrape the skin to a flatter appearance. It's ideal for people who have already reached their goal weight and have excess skin after pregnancy, weight loss or aging. Ideally, you need to hold your goal weight for at least a couple of months before the surgery. Performing the surgery before you reach your goal weight, and if you further lose weight after the surgery, it's likely to cause a recurrence of the excess skin. If your goal is to lose weight, this is not the tool for that. Diet, exercise, bariatric surgery, the weight loss injections could be the better direction for you, and do this safely. A tummy tuck is about reshaping and contouring and tightening. It's not about numbers on the scale. The results depend on you. Your starting physique plays a huge role in your outcome. If you have strong underlying muscle definition, you're more likely to get a more sculpted final look. If your abdominal muscles are weaker or your body fat percentage is higher, the results will be flatter but not necessarily six-pack defined. Your skin quality also hugely affects the outcome. Stretch marks will be repositioned to a lower position and may not be totally removed if they are extensive. Your fitness, skin quality and genetics will determine how wow the results are. So again, when you see amazing results on the internet, this is largely reliant on what they look like before, and also there's usually a bit of editing. Every surgery comes with trade-offs, and tummy tucks are no exception. These trade-offs aren't necessarily deal breakers, but they are changes that you need to accept before you can fully enjoy the benefits. Scar placement and stretching. A tummy tuck will leave you with a horizontal scar that runs essentially from hip to hip. Surgeons usually place it low so it hides in the underwear or the bikini line, but scars can evolve with time. They might stretch, fade unevenly, or heal darker and wider than expected. That's normal scar biology, and treatments can help this. They rarely erase it completely. They may be different on either side, and that's because the way you've healed and the contour of your body may be different on either side. For example, you may have more prominence on one side compared to the other. Therefore, the scar may need to be longer on one side compared to the other. The goal is to symmetrize the contour, and the length may be different on each side. During surgery, your skin is pulled down and redraped, which means your belly button gets a new home. The goal is to keep you looking as natural as possible, but sometimes the shape or position can look slightly different to the untrained eye. It's often unnoticed, but to someone familiar with a tummy tuck, it can be a telltale sign. Loss of natural skin feeling. Because the surgery involves separating the skin from the underlying tissue, the nerves in that area can be affected. Many patients notice numbness or reduced sensation in the lower abdomen afterwards. Sometimes that sensation comes back over months, or other times small patches stay numb long term. It's usually not painful, but it's a change that you need to be aware of. The recovery commitment. This is a big one. You'll need to wear a snug compression garment or a surgical corset for around 6 weeks, almost 24/7 in the early phase. This helps reduce the swelling and supports healing, but it's not exactly comfortable, especially in warmer weather. In the early stages, the mobility and posture may be affected. For the first week or two, you'll likely need to walk slightly bent over to protect your incision, and yes, this can feel awkward and uncomfortable. Sleeping can also be tricky. Most people need to sleep slightly propped up or in a recliner for a while. So, a balanced perspective. The trade-off is that you are swapping loose skin for a scar and potentially slightly altered belly button. But for many people, that's a trade that they're very happy to make. None of these trade-offs mean that the tummy tuck isn't worth it. For many people, the confidence boost and the contour improvement far outweigh them. The key is knowing exactly what to expect so you can make a confident, informed decision. Like any surgery, tummy tuck comes with real risk. Infection. Incisions are large, so the infection is possible. Proper wound care and following your surgeon's instructions are key. Asymmetry. Your body isn't perfectly symmetrical to begin with, and healing can make a difference, and it can be different and noticeable on both sides. Fluid accumulation. Sometimes fluid can appear underneath the skin and require drainage. Blood clots are also a risk because it's a fairly long procedure and you may be immobile for a long time, so there is a risk of clots in the lungs and the legs. Your surgeon will advise you to walk as soon as possible and you may be sent home with blood thinning injections. Poor wound healing, especially if you smoke or have other health conditions or don't follow recovery guidelines, you may be at risk of poor wound healing. So who's a good candidate? You might be a good candidate if you are at a stable, healthy weight. You don't smoke, you can quit before surgery, you have a good overall health, and you have realistic expectations of the scars and the results after. You need to be prepared for the recovery afterwards. So the final thoughts and advice. A tummy tuck can deliver dramatic changes, and it's not magic. It's not without trade-offs. Think of it as the finishing touch to your fitness and health efforts, not a shortcut. If you go in with realistic expectations, you can get results you love and avoid surprises along the way. Thank you so much for watching. If this helped you, give it a thumbs up and subscribe for more straight talk on cosmetic procedures. See you in the next video.